Okay, good morning, everybody. We finally had a nice spring weekend in central Missouri. So I left the city of Boonville city limits first time in 5 weeks. Drove to Columbia, went through my alma mater, and went to medical school at the University of Missouri Columbia. Um, Trying to see some spring colors. It's not quite there yet. My sister's a groundskeeper there. She told me I missed the best street. But anyway, I'll do it again around Mother's Day. So that should be fun, depending on what's going on in the country at that point, or yeah, at that point. Um, so, hey Tammy, good to see you. So what we'll do is we're going to talk about sleep. So for this week, Monday, Wednesday, Friday, 9:30, my usual class time for State Fair Community College. I do that for them Tuesdays and Thursdays. We're going to talk today. We're going to talk about sleep and the problems associated with lack thereof. On Wednesday, I'm going to talk about things that you can do that are natural, that you don't have to have a prescription or go to a doctor to find. And then Friday, we'll see what's going on with this virus thing. I'm assuming insomnia has gotten a little bit worse, although it's a problem most of the time. So I assume it's gotten a little bit worse during this pandemic and staying at home, et cetera, et cetera. So sleep is kind of a big deal. I have a protocol that I used as when I was a physician practicing. Anyway, I'm still a physician. But when I was practicing, I kind of swiped sort of a mnemonic from a physician, a functional medicine physician in Dallas. And I kind of took his mnemonic and turned it into what worked for me and how I approach things. So the mnemonic is shining, or my shining protocol. And we'll go through that protocol as we go forward. Not today, but today we're going to do S. And so the first thing I wanted to know when somebody came to see me as a doctor and now health coaching people in collaboration with doctors is sleep, quality of sleep. So almost my first question after what's your name, etc., is how are you sleeping? How well do you sleep? And it's amazing how many people that don't. It's fairly epidemic, lack of sleep, trouble going to sleep, etc., etc., from people in the United States. And so we've been we've been raised to be more productive. Productivity seems to be a measure of success in this country right now. The lack of productivity, whether that be forced or you choose to do that or whatever, is bothering people. So that raises anxiety rates, probably some depressive adjustment disorder problems. I hate labeling people with anxiety and depression because it can affect their future to an extent. Like, even if you have depression on your medical record, if you try to get life insurance, they ding you for that. Okay, so if you ask an American if they've had difficulty sleeping any time in the past week, 70% of them will say yes. Okay, so it's, sleep is a critical brain function. I mean, you cannot have your brain going 90 miles an hour all the time. You have to rest your brain. And you do most of that rest in the first third of your sleep cycle. So sleep really affects metabolic activity. It affects appetite. It affects the cardiovascular system. And for me, so the H part of shining is hormone balance, and we'll talk about that maybe next week. That's when your hormones are produced, secreted, released. A lot of your growth hormone, which is a youth hormone, is released about 4 o'clock in the morning while you're asleep. So if you're not resting well, you almost have a hormone imbalance de facto. It just happens. Okay, so in Europe, 45 million people will say they have disrupted sleep or what they consider not ideal sleep patterns. Okay, so if you look at this from a medical perspective, if you go to a sleep doctor, a lot of pulmonologists have sleep labs. There are about 100 things that they're going to look for, 100 conditions that affect sleep. Okay, most of them are in 3 categories. So you can take those 100 and put them into one of these 3 categories. One of them, or the most common, is not enough sleep, so sleep deprivation. Okay, then there's sleep disruption. So, I would ask people, do you have trouble falling asleep? Do you have trouble maintaining sleep? Trouble falling asleep, the most common. The second most common is you wake up and can't go back to sleep. So that's sleep that's not maintained or disrupted sleep. And the third one are sleep events. So this kind of goes in the category of sleep apnea, sleepwalking, as well as restless leg syndrome. And restless leg syndrome, those people, it's been somebody playing soccer while they're trying to sleep or while they are asleep. And the hormone basis of that is a dopamine disruption. So there really is a hormonal thing that leads to restless leg syndrome. So let me teach you a little physiology, and then we'll talk about the health effects that disrupted and poor sleep patterns can do, because they're a little bit frightening. So the physiology of sleep, there's 2 kinds for the most part. REM, well, for all the parts. There's REM sleep, or rapid eye movement, which is usually in the later part of your night or your sleep cycle. And then there are 4 stages. There's a newer classification that has 3 stages of non-rapid eye movement sleep. So stage 1, 2, 3, 4. Stage 3 and 4 has been, by the sleep study people, has been combined into one category. So it's rapid eye movement sleep stage 1, 2, and 3. Stage 3 and 4 are the slow wave sleep, and that is the most restorative part of your sleep. Interestingly, your deepest sleep occurs in the first third of your sleep cycle. And then the rapid eye movement sleep is what occurs usually in the last third. So one of the reasons you wake up and you're in the middle of a dream is you're having rapid eye movement sleep. So that productivity thing that we talked about is actually disruptive of sleep. So if you cannot shut your brain off and you have a disrupted sleep cycle or sleep deprivation, you actually become less productive. So you're racing to finish the finish line, and perhaps you never get there if you're not sleeping well. Okay, so during deep sleep, there's a change in physiology. Your heart rate goes down, your blood pressure goes down. So this is stage 3 and 4, non-rapid eye movement sleep. And then there's decreased blood flow to your brain. So your brain usually gets 15% of your cardiac output. That decreases during stage 3 and 4 sleep so that your brain can actually rest and your neurons can restore. Okay, so how does sleep wakefulness cycles work? Well, you've heard of circadian rhythms. There's a physiologic basis for circadian rhythms, and they affect more than just sleep. So they also control physical activity, they control metabolic rates, as well as temperature and heart rate, muscle tone, and hormone secretion are all under circadian rhythm control. So the regulation for sleep comes from the hypothalamus. So we always call the pituitary gland, you've probably heard this, as the master endocrine gland. Well, the general over the master is the hypothalamus. So the pituitary only really does what the hypothalamus tells it to do, and then it's involved in it's involved in a negative feedback cycle as well. So you can decrease activity of your pituitary gland by your body telling your pituitary gland, enough, we're good, we don't need any more of that hormone. Well, the hypothalamus has the circadian sleep wakefulness cycle. And so what it does is turn off the arousal system in order for you to be able to go to sleep. Okay, the wakefulness cycle is from the reticular activating system of the brain stem. And interestingly enough, since that's the wakefulness part of your brain function, that is exactly where amphetamines work. So people that are taking Adderall or Ritalin or whatever for ADD, adult or attention deficit disorder, whether a childhood or an adult version, are stimulating their reticular activating system. Cocaine works on that as well. So what happens is the mid part of the the hypothalamus is in the mid part of the brain, but there is a suprachiasmatic nucleus which is closely associated with the hypothalamus that gets its input from the retina. So one of the reasons when we have difficulty with daylight savings time is that it gets dark at maybe 5 o'clock, even before, and your retina is telling your brain, suprachiasmatic nucleus of your brain, that it's time to go to sleep. So people tend to be more sleepy and tired during the winter, right? Everybody knows that. Okay, so that that nucleus, excuse me, is involved with picking up those signals from the retina, okay, based on a night-day cycle. Okay, so if you have insomnia, so insomnia is actually different. It's a sort of diagnosis, even though you can't really come up with a specific diagnostic criteria, but it is one of the disorders of sleep disruption. So sleep apnea is one, sleepwalking is one, polyuria is one, getting up, having to go to the bathroom a lot is a sleep disruptor. Insomnia is its own little category. So insomnia comes from loss of those neurons that control that circadian rhythm. And then the pons, which is in the brain stem, is what regulates and switches off REM and non-REM sleep. So that's basically the physiology of sleep. Okay, so if you look study-wise, over half of Americans have trouble falling asleep. I think it's 48% in the study I looked at. Okay, and then about 52% of those have difficulty maintaining sleep. So 70% of Americans within any given week are going to have that problem. Okay, snoring is about 40% of those that have disrupted sleep. They have snoring. Okay. And then as far as a sleep disorder, where a physician says, yes, you have a sleep disorder, maybe you have a sleep study, whatever, it's 17%. So the actual medical diagnosis of a sleep disorder is about 17% of those 70%. So most sleep disorders or disruptions hopefully are acute and short-lived. Some of them become chronic. Those people are lethargic and fatigued all the time. Those are the people that go to sleep, they have disrupted sleep and wake up feeling like they need to take a nap and they need to go back to bed. All of us have done that. And then 60% of the sleep disorders that are medically diagnosed are sleep apnea. And if you have sleep apnea and you've used a CPAP, you know how aggravating and annoying a CPAP can be. That by itself, I think, would disrupt a lot of people's sleep. It's having to wear that nose thing or a face mask in order to keep positive pressure and keep snoring down. Okay, most of the sleep disorders are lifestyle related. Okay, so lifestyle factors: increased caffeine use, alcohol use, especially before bed, drug abuse. So think about, if somebody's using amphetamines or abusing, they're not going to sleep as well. And you don't sleep as well even though you feel like you're tired from depressants like alcohol. Shift work, we'll talk about that with a nurse study. So people that work nights, and me as an obstetrician, it seemed like the most common time when I would look at the clock in the middle of the night waiting for babies to come would be about 3:15 in the morning. I've seen 3:15 in the morning hundreds and hundreds of times. So doing that for a living is just a sleep disrupting thing to do. And then people that work night shifts have change their circadian rhythm, and they really have to stay on a good rhythm where they sleep during the day, and if they don't sleep during the day on their days off, their brain gets confused. Okay, then going to college, so all of my students are sleep disrupted by my physiology and anatomy lectures, so just going to the university or college program is associated with sleep disturbance. And of course, there's jet lag, which I didn't necessarily understand until I went to Rome about 10 years ago. And I thought, well, I'll just sleep on the plane. I can't remember. It was like a 9-hour flight, I believe. And when I got to Rome, I had a 4-hour drive down to the Amalfi Coast. And when I got there, I laid down and slept literally for 24 hours and didn't move. It felt like I didn't move. I never woke up. I never went to the bathroom, any of that. So that was a jet lag thing. And then I had acclimated to the time change. Okay, environment. If you have more noise around you, now some people have white noise, and that's helpful. But you wake up when claps of thunder, etc. And then increased light. The best way to sleep is in total, complete pitch black darkness. So night lights actually reduce your quality of sleep overall. Psychosocial factors like increased anxiety, worry, depressive symptoms. You also see this with parents of young children, especially newborns, of course. Caregivers to family members who have terminal illnesses or chronic illnesses or things that need to be monitored are going to disrupt your sleep. Okay, and then sleep disorders themselves, insomnia being one, obstructive sleep apnea, restless legs, night ambulism, narcolepsy. And interestingly enough, a lot of people take Ambien, and we'll talk about this Wednesday, but a lot of people take Ambien or Ambien CR for insomnia and trouble sleeping. And then one of the more dangerous things, one of the more dangerous side effects of Ambien is that people will sleepwalk. Okay, well, if they sleepwalk, they may sleep drive. So I've had patients that woke up driving down the interstate who were completely asleep. They just got up, got in their car, and took a little drive. So sleep driving is kind of a problem, I'm guessing, right? Okay, so medical conditions. So chronic pain syndrome patients, which is defined as anyone with pain that lasts for 3 months or longer, that's chronic pain. They have difficulty sleeping, of course. Restrictive lung diseases can cause difficulty just having trouble breathing. Chronic kidney disease, and really that kind of, to me, is really alluding to the fact that some people have frequency of urination or polyuria. And there are, so men, when their prostate glands get bigger when they get older, if that happens, they have to urinate. It takes them a while to get started. They might have to get 4 or 5 times a night. So that affects their ability to sleep. And then diabetes is associated with difficulty sleeping as well. Dementias and Alzheimer's disease people have difficulty with disrupted sleep or going to sleep or sleeping not enough. And then certain medications have sleep deprivation as a side effect. Okay, so what are the physiologic effects? So we talked about normal physiology and what's going on. And so disrupted sleep and insomnia can cause physiologic effects. So your catecholamine release is higher. That's with your sympathetic nervous system. Okay, so epinephrine is a catecholamine. You also have increased release of adrenocorticotropin hormone and cortisol. Those are the stress hormones from the adrenal gland. You have increased insulin resistance. So your insulin sensitivity goes down if you're not sleeping well. That has been known actually for quite a while, actually. You have decreased leptin levels in your brain. It's what tells you that you are not hungry anymore. And that's been implicated in insulin resistance, metabolic syndrome, and diabetes type 2. You have increased ghrelin in your brain, and that's the hormone in your brain that tells you that you're hungry. So getting up and looking in the refrigerator and rooting around and getting something to eat with disrupted sleep is based on a reduction in leptin and an increase in ghrelin in your brain. Okay, you have an increased appetite if you're not sleeping well. Again, the refrigerator at night. You have increased oxygen consumption, and thereby you have increased CO2 production, which makes you fatigued. Okay, and then you have upregulation of those cytokines. So last week we talked about the immunologic response to this virus, and the three that seem to be associated with the lung attack of that virus, is tumor necrosis factor, and then interleukin 1 and interleukin 6. Well, turns out that disruptive or non-restorative sleep increases the formation of tumor necrosis factor, interleukin 1 and interleukin 6. Okay, same exact thing. And then we talked about oxygen free radical or reactive oxygen species or radical formation. That is increased in people that have disrupted sleep. And then melatonin, which is the hormone that helps you go to sleep when your retina says it's time, it's dark, and your hypothalamus tells you it's time to go to sleep. There's a signal to the pineal gland to release melatonin. Well, people with disrupted sleep have decreased melatonin production overall. So that's the basis of people using melatonin to help them sleep. They usually do not take enough. There's studies that show you how to do that. We're going to talk about that on Wednesday. Okay. So, so what this suggests, all those physiologic effects suggest that the chronic illness or chronic disease or the health effects of disrupted sleep are through the sympathomimetic or sympathetic nervous system. Okay, so you're gearing everything up, and therefore you're having health consequences from that. Okay, you have decreased slow wave sleep, stage 3 and 4, and so that increases insulin release. So remember, all that goes down during slow wave. Everything kind of shuts down, not completely, during slow wave sleep. So if you're increasing your insulin release, eventually you can become insulin resistant. So you're just not as sensitive, and that's what leads to type 2 diabetes. Okay, so short-term health consequences of this is a disrupted sleep or increased stress hormone release. The adrenal glands are stimulated, and that seems to, if it stays long-term, have an effect on your heart, your cardiovascular system, and psychiatric conditions. Okay, so they did a study in Finland a few years back and showed that insomnia was correlated with people who have weekly headaches, and so lots of people have weekly headaches, and an increase in abdominal pain just from not sleeping. So weekly headaches and abdominal pain. Okay, sleep disruption has been shown to have a significant effect on depressive the effective your affect. Sorry, tried to mix 3 words. So depressed symptoms. I'm not going to say depression itself because that's a whole nother ballgame. But your affect. So depressed affect. Also burnout. So I don't like the term burnout for healthcare professionals, but it can have, but it seems to have caught hold. So executives, physicians, nurses, whatever job you're in, you can get burned out if you're not sleeping well. That raises that risk of you just saying, "Forget it, I'm done." Okay. The other thing is it alters your cognitive performance. So people, you're, like I said, if you're going 90 to nothing and you're trying to increase your productivity, you're actually not doing that. You're making it worse. So if we put you on a cognitive function testing protocol and you haven't slept as well, you will not perform as well. So people thinking, I'll sleep when I'm dead. I've got too much to do. Like I kind of used to think when I was in my 30s and 40s, I'll sleep when I'm dead. I got too much to do. You're actually not effective. Okay, so your attention is decreased, your executive function is decreased, your judgment is decreased, your decision-making capability is decreased. You have an increased risk of risky behavior. Okay, and they've shown that 20% of car wreck injuries, serious injuries from car wrecks, are related to sleep deprivation independent of alcohol use. So driving when you're sleep deprived, you have the same impairment as somebody who is driving while intoxicated. So DWI is the same as driving when you're sleepy. Okay. In adolescents, they've correlated sleep deprivation with poorer education and school performance. They have more anxiety, they have more depressive symptoms, and they have an increased risk of suicidal thoughts or actual suicide. And of course, children, younger children, we all know when they need to sleep because their behavior gets out of control. So behavioral problems in younger children are well known by any parent. Okay, so that can be all short term. What about long term? If you can't fix this, you can't get a hold of it. Okay, so long term, due to that sympathetic nervous system, epinephrine, etc., elevation, you elevate your blood pressure instead of reduce it and reduce your heart rate and your cerebral blood flow to your brain. You actually elevate it. That's what the sympathetic nervous system does. So it's been correlated with increased body mass index. So that's a way of measuring abnormal weight, either whether that be low or high. Most of the time it's high. So inadequate sleep is associated very well with obesity. And then that increased BMI and potential obesity can lead to the metabolic syndrome of insulin resistance and then eventually type 2 diabetes. Okay, you have an increased cholesterol level, total cholesterol. That's the subject of a whole nother one of these where we talk about cholesterol, but your HDL cholesterol, one of the little taxis that move your cholesterol back to your liver for normal processing. What people call the good cholesterol is reduced in people with sleep deprivation. And then they've shown in middle-aged women that have sleep deprivation, they have a higher risk of myocardial infarction while they're asleep, so heart attack. Okay, metabolic changes. One study showed that one night of disrupted sleep was equivalent to 6 months of poor dietary habits. They specifically targeted high-fat diets, and we could argue that as far as poor dietary habits. But just one night of sleep has the same effect of poor eating habits for 6 months. That's kind of amazing to me. Okay, you have altered glucose metabolism if you're not sleeping well. That's what leads to the increased insulin release and eventual insulin resistance. Your cortisol level is elevated. That's your stress hormone from your adrenal gland. So people, I used to, if you could do this, it's kind of hard to do, but you can measure an early morning cortisol level, and really if you could get somebody to get their cortisol level drawn at 10 o'clock, for those that have trouble initiating sleep or falling asleep, their cortisol levels are usually higher than what normal people's are. So by the end of the day, you want your cortisol and your sympathetic nervous system to be downregulated so that you can actually fall asleep and stay that way. Okay, what about cancer? Well, there's an association because of an acceleration of tumor growth. That's been shown with sleep deprivation. And it seems to be somewhat related to the actual reason hasn't been elucidated completely, but decreased melatonin production has something to do with that, because melatonin, if it reduces, can increase reproductive hormones, so estradiol, testosterone, progesterone, as well as decreased DNA repair, which melatonin also does. There's less tumor inhibition. So reduction in melatonin reduces tumor inhibition factors. And also, melatonin is a free radical scavenger. So we talked about last week all the free radicals, oxygen reactive species. So there's less free radical scavenging going on at night with less melatonin being produced at night. Okay, and then if you look at nurses, they did a study on it's called the Nurses Health Study, on night shift work and sleep patterns, and they showed a fairly clear association with an increased risk of colorectal cancer. The other, for men, sleep deprivation seems to raise the risk of prostate cancer by about 1.8. The colorectal cancer in nurses was not quite that high, but it was there. Okay, so what about death? There are a few studies that have showed, specifically in men, that disrupted sleep patterns increase mortality from all causes. So you have a higher likelihood of dying from anything if you're not sleeping well. It's when that's when your body heals, is while you're asleep. Okay, so there's also an increased risk factor of suicide in the general population for people who don't sleep well. And then those with chronic medical conditions have a higher risk of death from those chronic medical conditions. So with increased death rate from all causes, so I'm not going to say it's just chronic medical conditions, but the chronic medical conditions that get altered with abnormal sleep are increased symptoms of irritable bowel syndrome, inflammatory bowel disease like Crohn's disease. Also, GE reflux is more common. And of course, GE reflux by itself is an instigator for people not being able to sleep. They get heartburn, they have to lift the head of their bed. Now the FDA has banned the histamine receptor blockers for GE reflux. So there are other options available to take care of that. So what's the best night's sleep? Okay, so the all-cause mortality in men is anybody that sleeps less than 6 hours. So any man that sleeps less than 6 hours has a higher risk of all-cause mortality. Interestingly, you get the same problem if you sleep 9 hours or more. So the ideal sleep cycle from studies is uninterrupted sleep for 7 hours. So 7 to 7.5 hours seems to be the golden point for good sleep. So what we'll do, so that's an overview of what health effects abnormal sleep and disrupted sleep have on you. On Wednesday, we're going to talk about what you can do about it. In the meantime, have a great start to your week. I checked, it's really Monday. It's April 20th. I looked on my phone because people are having trouble remembering what day it is. It is Monday, April 20th, and I'll see you Wednesday at 9:30. We'll talk about how to fix this. Talk to you later. Thank you.